Hello everyone, this is Dr. Pritpal Singh from an MD from CMC Ludhiana. And in my previous sessions, I had started with the drug use in special population where I talked about the drug usage in pregnancy and lactation. Today, I'll be talking about drug use in pediatric population, and in the coming sessions, I will be talking about drug use in geriatric population. Now, as such, when we talk about this pediatric population, as per the new CBME curriculum that has been implemented in 2019, this particular competency has been described as a competency PH 1.56, which says describe basic aspects of pediatric and geriatric pharmacotherapy. So with this particular presentation, which would be on pediatric population, I hope I'm able to give some insight into the prescription that is done in pediatric population. And I hope that I would be able to clear some doubts. So when we talk about pediatric population or the pediatric medication, there are certain general population and there are certain limitations. So the first limitation of this is that most of the drugs that are approved, maybe say, let's say 75% of the FDA approved medications, they do not have indications in children. And most of the drugs that are used are being used off label, and it is not used by being everyone, but it also being used by subgroup of practitioners also. There are specific lacking indications for a particular regime by the FDA, and safety of most of these drugs is based upon the post-marketing reports of adverse events. So when we talk about the developmental pharmacology, let's keep one thing very clear in mind, that children are not miniature adults. So whatever dose is being given in an adult cannot be subdivided to be given in a pediatric population. And when you're giving a drug in a pediatric population, you need to know the dose instead of going by a hit and trial method. So because there are a lot of pharmacokinetic differences in children and they tend to vary with age. And the problem is circumvented further, that some drugs that are considered safe in one group of pediatric patient could not be could be ineffective or maybe toxic in another group of individuals. And when we talk about the hepatic enzymes and the metabolic pathway, they tend to mature at different rate, and the maturation is asynchronous. So when supposedly there's a primary route of a drug whose metabolism is immature, it may be shunted through an alternative pathway. And the classical example being the paracetamol toxicity that is most commonly seen in children. Then a drug dosing dilemma can be avoided only by using only those drugs which have a scientifically supported dosing. So let's talk about certain key points, certain pharmacokinetic parameters that are there. In infants, let's first start with infants. Metabolism of most drugs is reduced. Obviously, it is understood. And as such, GFR is 20 to 40% of the adult's capacity, and it increases the first week of life and reaches maximal by 12 months. In general, when we talk about children over 10 years, the organ development and metabolism are quite similar to adults, and you may require to make dosing adjustments based upon the body surface area. The body surface area being another parameter that could be taken into consideration if you want to give a dose to a child. Other key points are, let's talk about the GIT, the GI tract acidity, the enzymatic activity, and the motility. There is a lot of difference in infants and young children, which could alter the absorption of many drugs that are given by the oral route. Drugs that are weak bases increase drug absorption, and drugs that are weak acid reduce drug absorption. As such, is different from what is being talked about. There is a reduced transit in the GIT, and this delays absorption and peak plasma concentration time, but not the amount of drug absorbed. So because of the reduced transit, the absorption is delayed, but it is not, the amount is not less, but the peak plasma concentration is delayed. Then, if you look into the absorption from the transcutaneous route, obviously it is infant, and there is always an increased risk of adverse effects. So it is always advisable to be cautious whenever you are going for topical use in infants. The volume of drug distribution in infants and young children is increased due to increased body water. So what you need to do is you need to increase drug doses for water-soluble drugs such as aminoglycosides and drugs that are lipophilic. example diazepam, they can exhibit a lower volume of distribution that you need to keep in mind. There is also an alteration in protein binding and tissue penetration of the drug, which may lead to reduced or exaggerated response. Now, these are certain pharmacokinetic parameters that are important that you need to assess. And then there are certain practical tips that you could always follow for writing a pediatric prescription. Now, what are these prescriptions? The first thing that you need to keep in mind is always obtain a weight of the patient. So you'll be able to monitor what is the exactly growth pattern and how the child is growing up. You may have the growth chart and you could follow the growth chart. As a rule, always start with the smallest dose in neonates and infants. Round up the dose. So how do you round up? Now, round up the dose, we don't follow the conventional mathematic formulas out here. If it would depend upon whether this particular drug has a narrow therapeutic window phenomena or or it has a broad therapeutic window phenomena. If it is a narrow therapeutic window phenomena, you will round off to the lowest dose. The dose it falls between the unless if it is a toxic drug or a drug with a narrow therapeutic index for window phenomena, you'll have to go to the lower side. Always, if when you are using acetaminophen, always calculate the dosage using weight and not age. And always specify preferred formulation what you're trying to use. Example, whether you're using a chewable tablet, you're using a suspension, solution, whatever is being used, you should be clear about what you're doing. And the most important point is stay abreast with the latest update. Stay current with the literature. If these things are followed, seldom you will go with a wrong prescription in a pediatric population. And I believe whenever you are looking for a pediatric population, it is always advisable to stay abreast with the current knowledge and prescribe accordingly to a pediatric patient. That's all from my side on prescription in the pediatric population. Some key points have been told to you. If there are any queries or questions, please get back to me in my chat box and I'll definitely get back to you. I hope you have been able to clear some here, and I wish you a happy learning and a great day ahead. Thank you so much for your patience.